Okay, so, I'm having top surgery in 4 days. So I guess I just wanted to document the process, and I guess this is where it begins. I guess I'll do a little backstory. I came home, or I moved back to New Jersey at the end of January, and I didn't, maybe a month, 2-3 months, between a month and like 3 months, I found out that top surgery was actually covered under my insurance plan. So once I found out it was covered, I knew I had to get a letter from a therapist stating that I was of sound mind and making, appropriate decisions for myself. So once I found that out, I found a therapist with the help of my mom's best friend, Melissa, who's an activist, and she called around and found me a good therapist to see. So I ended up going to a therapist who had never had any experience with anyone who is trans or non-binary, or who has a gender identity different from what they were assigned at birth. And I did this because I found that most of the gender therapists who do letters for surgery were trying to rip you off. They wanted like $600 and like a base price of $600, and weren't even guaranteeing you a letter. So I went to somebody who wasn't just trying to get a buck out of it, and who I could sort of teach and give knowledge about the community, and also help me get what I needed, which was the letter. So, and I also wanted to go to someone who I could go to not just because I needed a letter. So I wanted somebody that I could talk to and get a letter from, but who I could also talk to. To go to somebody who could give me a letter, but someone who I could also talk to about personal things that, whatever was relevant at the time or in the future. I wanted somebody that I could go back to later afterwards if I needed to, just for my own mental health. So I chose this person, and I've gone 6 times, got a letter, and in the meantime, while I was going to therapy, I found a surgeon who is out of New York and is seemingly the only one covered under my insurance. And when I say covered under my insurance, she's literally covered under the out-of-state portion. So it's not considered a tier 1, which would have been 100% covered. It's under tier 2 since it's out of state. So that was 80% covered. So I was on her waiting list for months, and I was calling every week saying, because my backstory, my dad is switching insurance at the end of the year. He's retiring, so I will no longer have his insurance. And I wanted to get this done before I lost the insurance policy. So I kept calling every week saying, I need to have this done this year, where are we at with the wait list? And they kept saying, oh, well, she hasn't made a schedule yet, blah, blah, blah. Come to find that I get a call that she's no longer with the place that she was with, and she's opening her own private practice, which turned out to be a blessing for me. I called the private practice, and I got an appointment, a consult, for the first day she was opening. So I went to the consult. It was great. I mean, literally couldn't have asked for more. It was, beyond my expectations. We got along really well, and she does the surgery how I want the surgery done. it was just easy. It was like the easiest part of it all, which, of course it would be. So I went to my consult. That was great, and so she just needed the letter from my therapist, and then I sent that in, and then everything would go to pre-approval for the insurance, and it's just been a waiting game now. So yeah, it's Sunday, Sunday, October 14th, and my surgery is on Thursday. So I don't know what time my surgery is at yet, which was kind of odd. Apparently the hospital calls like a day or so before to let you know when your surgery is. And my surgeon's office pretty much said that my surgery is probably going to be one of the first ones because I have a latex allergy, which is great by me, Makes my life a little bit easier. So that was good news. So yeah, I'm just
right through these doors here. We're gonna head back that way. All right. So get a call when you're all done. All right.
cool. Okay, bye.
Okay, bye.
Thank
Love
you.
you.
Love you too.
Take good care of them. All right.
Okay.
So, hello. I just got out of surgery and I'm feeling, I don't know, it looks like I don't have my glasses on. So I'm just like a little fuzzy.
You have them on.
I know, but it looks like my sight
Right,
is just a little groggy.
right.
My mouth is somewhat dry. I had some water.
Hey, Alex.
Hi.
How you doing?
Great.
Good.
Thank you so much.
No problem. All set with everything, okay?
Okay.
Thank you.
Yeah, I could sleep for like 5 more hours.
Yeah, I hear you. Me too.
But the pain is at like I don't know, 4,
Yeah,
4.5.
yeah. She said you
It's
did great.
minimal.
She said you did great.
Yeah,
Uh-huh.
whatever that means.
Yeah.
I mean, I was asleep, so.
I know. Yeah, it was,
2 hours.
yeah. I thought it was going to be longer. Yeah.
That's crazy.
Are you happy?
Yeah. Yeah. It's fucking flat. So cool.
All right.
Step 1 done.
Step 1 done. All right. So we're going to sign off for a bit.
Okay.
We'll be back.
Talk to you later. Is it recording?
Yeah.
It's just like looking down, like it just looks so normal, like the way it was supposed to look. So it's really an interesting feeling because I wasn't sure, obviously, going into this. Like I was sure this was what I wanted to do, but like looking down, like it just looks normal.
How it's supposed to look.
Yeah, it just looks how it was supposed to look.
Okay, here's Alan, room 17.
Floor 3.
Is it room 17?
Yeah.
Room 17. Yes, in the Kimmel Pavilion of NYU Langone.
Nice TV.
He's watching some TV here.
My drains are pretty full right now. But yeah, it looks,
Okay, he's a new man.
looks pretty good.
He's pretty happy.
Yeah. I have no idea what my hair looks like or what my face looks like. But it's the morning. It's what time is it? It's 8 o'clock. I stayed in the hospital overnight, and they just brought me some breakfast. And they brought me vegan butter for a roll. They brought me some potatoes and orange juice. My throat hurts still from the breathing tube, but I have no recollection of the breathing tube. And yeah. Alright, so howdy. I did the thing. They're gone. I mean, it's totally awesome. So I got my drains out and my bolsters off yesterday. So you can see the nips. They're looking pretty pepperoni. So I have to put this bacitracin on twice a day. And I can't really feel it, so don't worry. It's not painful. Just a little bit of that. A little bit of this. I mean, these things look dang legit, if I don't say so myself. And then I have to cover them up. And I'm going with the method of the less tape, the better. Because as you can see, I've got some chest hair, so that just hurts a ton. I don't know. I feel like I keep forgetting that I don't have the drains in anymore. And I mean, I can lift. Like, there's stretching it. Just stretching it. But like, with the drains, I just wanted to be super careful. It's weird having drains. Alright, so let's just get... Let's probably look. So there's that side. So then, yeah, you can see right here where my drain was. And then you can see the drain on the other side. Tape to tape. What it doesn't kill me. So that kind of looks bruised, which, yeah, is to be expected. But yeah, so there you have it. I'll keep you guys updated in the future, but thanks for watching, thanks for supporting. Like, holy mac, I've gotten so many messages and texts and calls. You guys are awesome. Speaking of, I'm getting a phone call right now. Gotta run.